We're very happy to have John Ioannidis here with us. John is the C.F. Rainboard Chair in Disease Prevention at Stanford University and Professor of Medicine, Professor of Health Research and Policy, and Director of the Stanford Prevention Research Center at Stanford University School of Medicine. Also Professor of Statistics at Stanford University School of Humanities and Social Sciences, and one of two directors of the Meta Research Innovation Center at Stanford, member of the Stanford Cancer Institute and the Stanford Cardiovascular Institute, and affiliate in the Stanford Center on Longevity and the Woods Institute for the Environment. Wow, that's quite an extensive set of responsibilities. He was named one of the most influential scientists alive by The Atlantic, which also awarded him the Brave Thinker Scientist honor in 2010. Ioannidis is one of the top-cited scientists worldwide and continues to create discussions about excellence in research. His thought-provoking article, which I read many years ago, Why Most Published Research Findings Are False, has been the most accessed article in the history of the Public Library of Science, with over 1 million hits. His presentation today, this will be later this afternoon, on bias and reproducible results reflects MSU's commitment to research excellence and examines fundamental aspects of the scientific method as it is applied in the complex modern setting. The talk this afternoon is sponsored by the Office of the Vice President for Research and the Center for Ethics and Humanities in the Life Sciences at MSU. So John, as you can tell, I'm very happy to have you here.
Thank you for the very kind invitation.
Question number 1. 10 years ago, your paper, Why Most Published Research Findings Are False, focused attention on a serious problem, or at least what I consider a serious problem in scientific research. How would you summarize this problem for non-experts?
So the paper tried to look at the big picture of how common it is when we make a new discovery, claim something that is a significant finding, for that finding or that discovery to be true and not to be refuted down the road or found to be grossly exaggerated. And there were some empirical data that had started accumulating from evaluations that looked at the replication patterns of different types of research, and some of the signals were very worrisome. So the paper tried to put together a mathematical model to see what the expectations would be under ideal circumstances, under probably less than ideal circumstances. And the conclusions were that it's very common in many scientific fields operating with some particular mode of designing and implementing and reporting studies to see a very large number of false positive claims. And in many cases, one would expect to see the majority of the claims of discoveries and significant results to be just false positives, not real things, but red herrings or just the result of bias and random chance.
Could you recount for us a little bit about the initial reaction to the paper? So maybe from your the colleagues around you, or the first seminars you gave on it, and then later from the broader community?
So I think that the initial reaction was not necessarily negative, although some people questioned whether that is indeed the case. I think that overall the paper was well received even early on, and I think that there was increasing momentum building over time, with more people interested to take a look at the bigger picture rather than just single studies, which is what all scientists are doing, including myself, for a very long time. And I think that since then there has been a lot of very interesting discussion and contributions, both in terms of theory and observations and empirical data for replication patterns in very diverse fields, both in biomedicine but also beyond biomedicine.
So I'm interested in how researchers in fields such as psychology or biomedicine have reacted to your results, or maybe adapted to your results. Do you think that there's now an appropriate level of caution and skepticism in interpreting published results? Or would you say the general understanding of your work is kind of superficial?
It's very difficult to give an answer that would cover every scientific field, because I think that the main characteristic of what's going on now is that there's very large heterogeneity across different disciplines. So there are lots of scientific disciplines that have long had a very rigorous pattern of conducting research and have adopted practices for replication and for stringent statistical thresholds and collaborative work, teamwork. data sharing, sharing of protocols, materials, and everything, transparency being very prominent. And I think these were doing very well, and they continue to do very well. There have been others that probably had very little of that or even none of that. And the uptake of such practices and processes has been fragmented in many of them. So it's difficult to give an answer that I could give like an average number, because maybe
Right.
that would be misleading. But I'm pleased that more and more scientists and more disciplines pay attention to some key themes. And I think that in many fields we have seen clearly major improvements over time.
How about practicing physicians? Do you feel like they have an appropriate skepticism, a level of skepticism for published results? Or?
I think that that physicians are a very interesting group, because they're at the interface between science and application to health and patients, and obviously this can make a big difference for our lives. There's probably increasing awareness of the caveats and biases and limitations that exist in medical evidence. I think this is beneficial because people are now asking for more rigorous evidence, and they're not happy to just say that this is the way that we have been doing it all along, and we will continue doing it this way because this is what our textbooks say, or this is what I learned in my training from my professor. People are asking for more rigorous evidence. We still have a problem that probably training is not uniformly rigorous in terms of evidence-based medicine principles of research, not only design but also appreciation and interpretation of the results. And clearly there's also some additional stakeholders and factors in biomedical research that make the situation more complicated. For example, some of the financial biases are probably of a different magnitude compared to what one might see in other types of research. There's plenty of stakeholders ranging from hospitals, healthcare systems, insurance companies, advocates, companies, industry, and trying to align the interests of all these players is not easy.
Mm-hmm. Coming back to science proper, leaving aside physicians, how much of the problem is due to bad incentives, and how much due to, say, cognitive or behavioral limitations on the part of the researchers? Is subconscious bias a bigger problem, or lack of facility with statistical thinking?
I think it's both. So to some extent, bias is even embedded within the scientific process. I need to think in a biased way to come up with a new idea that has not
right. And to get excited about it, to do the experiment. Yeah.
So I need to have some drive that is not probably just average.
Right.
And therefore, one doesn't want to remove that. I think that the excitement and the expectation of making discoveries and coming up with fascinating findings is part of the scientific process itself. At the same time, that means that one has to be aware of that inherent bias and try to counterbalance it. And the way to do that, I think, is better training, better methods, better standards, better practices on the way that we conduct research. So I think it's a bit unfortunate that most of us, when we're training in a scientific field, there's so much to learn in terms of the subject matter and the very latest news of the newest technology that is available. Mm-hmm. So that much emphasis is given to that and trying to catch up with what is the new chip that can measure 10 times or 100 times or a million times more than I could do last year. And this means that less emphasis is given probably on methodologic training methods, rigorous statistical, analytical tools, and the way to use them, interpret them, and not be fooled by them.
Right. If Francis Collins were sitting here, would you be willing to tell him that some large fraction, perhaps even 85% of NIH research dollars are wasted?
I think I've told him that before. I've written about it, so it's not a secret. And I think that he also knows that. And this is why NIH has taken the lead in several initiatives to try to improve reproducibility. So reproducibility is a very big thing, I think, in the current research agenda at NIH. I'm not sure that all the solutions that are being implemented or people are speculating to implement are necessarily the best ones. I think that for many of them, we need some better testing because sometimes we have seemingly good ideas or seemingly very beautiful ideas, but in reality they don't work. So if NIH could take the lead in this effort, I think that it would be extremely influential, clearly, because it's the major funding agency in this country and the biggest funding agency around the world. Many funding agencies have already paid attention to that. I have been in touch with colleagues from funding agencies all over the world who want to implement different changes. And I think this is good news. At the same time, it needs to be coupled with rigorous evidence about what changes are to be implemented. Because I don't want us to find ourselves in a situation where we just add more bureaucracy and more administrative checks without really improving the science. I think it's the science that should decide how the science should be improved, rather than just say, if we add some more checklists and we add some more steps for you to torture you, then that will fix the situation.
Yeah, I agree with that. So I want to talk about one particular case that I'm familiar with because I do some work in computational genomics. So my read of the last roughly 10 years of the field is that early on there were these candidate gene studies in which people had very strong priors, very strong biological intuition that drove them to accept fairly low, fairly modest thresholds in terms of significance before they would assert that some gene actually had some causal effect. But then it took a long time for the community to understand that they should really be correcting for multiple testing. And now there's a standard of p-value of threshold of something like 5 times 10 to the minus 8, which is corrected for the presence of, say, 1 million SNPs in the genome. And now things, as far as I understand, replicate routinely. And so it seems like an actual case of a community that learned over a period of 5 or 10 years of bad practices and eventually good practices. Maybe you could comment on what your perspective is on that.
I think that this is clearly a success story. And as you say, the replication rate of the candidate gene error, based on what we know now, was somewhere in the range of 1% or maybe a little higher than that, but not
pretty
much
bad.
higher.
Yeah.
So about 95 to 99+% of what we thought we had discovered was not correct at that time. Conversely, pretty much everything that crosses a genome-wide significance threshold currently, I would say, has very, very high chances, or almost the opposite, 99% chance of being replicable. Clearly, this is a nice story, and the question is how much of that transformation could be applied to other fields. So more stringent statistical thresholds could be applied. One there nevertheless runs the risk in some cases in fields where it's very difficult to come up with very large sample sizes that unavoidably the false negative rate will be very, very high in doing that. Then collaborative work and team science, which is another transformative principle that helped genomic epidemiology to mature, could be implemented almost in any field that I can think of. So the current example in most biomedical fields has been the siloed investigator kind of struggling with a small sample size to achieve something, which almost always is a false positive or close. And conversely, many other fields, physics, for example, has a very strong tradition in collaborative work and teamwork. And you can imagine how difficult it would have been, for example, to discover the Higgs boson. If instead of having 10,000 scientists join forces and have one big experiment, say that we'll give an R01 to each one of 10,000 people, and each one of them has to deliver a Higgs boson within 4 years. We would get probably 10,000 Higgs bosons, but
all of the wrong maths.
So, and then the other major improvement was the accuracy of the measurements. So the field matured in terms of both the ability to measure in very large scale, but also the accuracy of the measurements. The error rate went down tremendously. Data sharing was also another contributor to this. People are willing to share data in that field far more than in other fields in biomedicine. how much of that is happening in other biomedical fields? Probably not that much. But of course, there's exceptions, and I think we see more and more of these principles being adopted. But I suspect that if more fields could adapt their practices to adopt these principles, things would be much better. It wouldn't solve all the problems. So genetics has some advantages.
Sure.
For example, I don't have to worry that much about confounding.
Mm-hmm.
Conversely, if I'm trying to find out about what diet is best or different types of exposures, they're so heavily confounded with each other that it's very, very difficult in the absence of experimental studies to be able to understand what is real and what is just a confounded effect.
Please tell me your reactions to this quote from Upton Sinclair. Maybe you're familiar with this. It is difficult to get a man to understand something when his salary depends on his not understanding it.
Oh, okay. That's a very interesting quote. Salary is one type of incentive, and I think that reputation is another type of incentive. Having a respectable career, making progress, being promoted, being recognizable, all of these are incentives. So if our incentives are misaligned with what we want to get, we will not really have the best outcomes. And there is probably some concern, and some people think that it's a major concern, that our incentives are not well aligned with what we want from science. So we are rewarding people for getting significant results, with the outcome being that 96% of biomedical papers claim significant results, most of which don't materialize.
Right.
We are rewarding people to come up with extravagant claims, with the effect being that most of these claims don't get replicated. We are rewarding people to not care about replication, because then they're considered to be Me Too efforts and kind of low priority. So I think that possibly we could amend the current status by changing the reward and incentive system and really placing emphasis on reproducible research, on high quality work, on sharing, on translatable findings, as compared to just more significant, more extravagant, more extreme, more unusual results that may not necessarily be true.
There's a similar quote which you may have heard from the financial markets, where the quote goes something like, "In the short run, the market is a voting machine, but in the long run, it should be a weighing machine." Yes. And so, a company can have a lot of hype and make a lot of money in the short run, but people in the long run tell whether they actually created value for their customers. And
of course.
Similar analogy.
And science clearly is a very long-term endeavor. And most scientific discoveries, they take a couple of decades to materialize into something useful, and sometimes even longer than that.
Sure.
It's an endeavor that has no end. So if we just try to find something that will make us happy for this year, but forget about what will happen 10 or 50 or 100 years from now, this is not really aligned with what the scientific tradition has been.
What would you say is the minimum level of statistical or probability expertise necessary to understand and use the scientific method in a setting with noisy data? Can you characterize that at all?
I'm not sure that I can say that there's a minimum. I think it's an open-ended type of maximum expertise that one should try to get. So as I said earlier, I think we need to invest more on methodologic and statistical training for scientists. And I think that the challenges are getting more and more complex, almost on a daily basis. So this is not something that someone will probably learn in graduate school and take a few courses and that would be it.
Right.
I see that as a continuing education situation where it's an integral part of being a scientist, trying to catch up with the new methodologic challenges that appear in your field and beyond, and also in an interdisciplinary manner. I think clearly we are lagging behind as far as that's concerned. I'm not sure what the minimum would be. I think it's kind of an evolving target.
Do you think most published research findings in, say, mathematics are false?
Mathematics is very different. My model was focused on situations where you have empirical data and inferences based on some sort of statistical testing. In that case, it was testing of hypothesis in a frequencies mode, although you can see the same situation appear if you have a Bayesian or an FDR approach, provided that the same forces operate. In mathematics, it's not an issue of empirical testing and falsification. It's an issue of theorems and consistency of theorems. So I don't think that one could extrapolate to theory of mathematical research. I think that when it comes to fields that maybe in the mathematical physical sciences where there is empirical observation and testing, the same principles would apply.
Yes.
But then the question is, what is the operational environment where this research is being done?
Right. I guess I could comment. I'm in theoretical physics, but obviously we watch the experiments very carefully. And I remember as a graduate student when I first heard some very strong earth-shattering experimental claim. But then I looked at the more senior people, the professors, and they would sort of shake their head and said, that's not going to be right. Mm-hmm. And I would ask them, well, these guys seem very sincere, hardworking experimentalists. They have, 4 sigma, 5 sigma, result. Why are you confident this is going to go away? And then they would say something like, well, would be very hard theoretically to accommodate that, so that's a little bit of bias. But the general observation which stuck with me was they said, in our field, that at any given moment, there's going to be a 4 or 5 anomalous 4 or 5 sigma result, which is eventually going to go away after people try to replicate it, and it's just that's always going to be the situation. Right. And so I think in physics we got used to that, and we don't really internalize belief. We don't update on an experimental result until well after it's been replicated and looked at by lots of different people. And I think other fields could get to that point, but they just need a cultural shift or something.
Of course, and I think that there are differences between the physical sciences and biomedical science. Obviously, the dimensions and the complexity are also not at the same scale, because I can think of zillions of situations in biomedical and epidemiological research where you get not just 5 sigma but 50 sigma.
Right, but still wrong.
And still it's wrong. And you know that it's wrong because you expect it to be wrong in a confounded environment.
Yeah.
I'm working on a database where we have the whole population of Sweden being involved, and we get p-values of 10 to the minus 100.
Right.
And we know that they're wrong consistently.
Right.
So, and I think another difference is that physics has had a stronger tradition of replication and openness and sharing with the community. So, for example, you have the gravitational waves proving inflation about a year ago.
Your colleagues at Stanford.
Exactly. Yeah. And I think it was less than a year, probably just a few months. It took to find out that it was probably just dust, if I interpret correctly.
Yep, that's right.
So I think that does happen in biomedicine as well. So to some extent, for example, we had the claim that there's alien bacteria that can use arsenic instead of phosphorus.
Oh, right, I remember that, yeah. So that turns out not to be true?
It took a little longer, a couple of years.
I didn't follow it, so I just heard the claim, and then,
Sometimes it's just the claim that it makes. And this is another risk, that once a very big claim has been
lodged
made, even when it's thoroughly refuted, it will remain there.
You had a result like that, right? So sometimes, even though things were solidly refuted, most people would cite the original paper, which actually
Exactly. So people continue to cite the original Nature paper that beta-carotene would save us from cancer, even though we had 6 very big randomized trials with hundreds of millions of dollars spent to get these results, showing there's absolutely no benefit from that. So it's not easy to say that we will just wait for science to self-correct itself, which it does happen, and I think that we have to be cautious about allowing some erroneous statements to linger in the literature, and maybe it's even better to be preemptive about not allowing them to
have a SWAT team that goes after quick replication funds or something. Or
that would be nice, and people are really excited about this in biomedicine. They're doing this in psychological sciences.
Yeah, I just saw there's a big project that just concluded, right, with 100 replication attempts or
With,
something.
I believe, 60-something% not replicated,
yeah.
although there's question then on what is replication.
I could not tell from the Nature article exactly what that meant, the moderate evidence for, and I'm waiting for the actual.
I want to see
I want to see what the actual science article says. So, yeah, very good. So, Kahneman and other economics researchers have suggested that successful traders in the stock market are often more likely, or generally more likely, to be lucky than actually good predictors of markets. Yet this point is poorly understood by most investors and even by the managers of traders. Could you compare this with the situation in science?
So who would be the traders in medicine?
Well, I think individual researchers. So,
yeah.
So is it possible, for example, even that researchers who make discoveries that later turn out to be true, is it possible they're more lucky than good?
That's a possibility. In some fields, I think that luck is very important. So, for example, I have been involved in many consortia in human genome epidemiology, where we get dozens of teams together in very big sample sizes and use thorough scanning of the entire genome to try to identify some risk variance for the disease of interest. And there's one consortium on each disease of interest. And some of them were very, quote-unquote, lucky, and dozens and hundreds of gene variants were discovered.
Right.
Others were not that lucky, and we went through lots of dry periods and getting nothing and struggling to get a larger sample size,
Sure.
get even more teams and try to get funding even though we had found nothing, which
Right.
is not so easy.
Right.
And eventually we got a few risk variants. So is it that the teams that I was working with who got hundreds of variants discovered, were they better scientists compared to those who found one or nothing or two? Probably not. I think the principles were the same. The concepts, the ideas, the methods, their implementation, I think, was as rigorous in one field versus the other. So clearly there is some component of luck, although I would argue that the common denominator in both cases was that both teams, and both types of teams, they used equally rigorous methods. And I think that this is really what we should reward.
Right.
Obviously, I'm not going to take something that doesn't work to translation,
right?
To try to save lives.
Right.
That's impossible. I think that we need to revisit that, because this may not be such a rare situation, that to some extent there is some component of randomness in discovery. And I think we just need more research to decide on this.
You know, the example you gave, I think if, the genetic architecture could vary quite a bit. So if you don't have alleles accounting for large chunks of variants to be found at the beginning, you'll get zero for a while until you reach some threshold.
Right.
Final question, and I thank you very much for doing this. I think people really enjoy your comments. What advice would you give to a young scientist just starting their career?
Well, that's a very tough question. I think probably I would say that they need to make sure that they enjoy what they do, and they are very excited about it, that they have no preconceptions about what they should expect to find. They should be open to all possibilities, and continue having fun, but also be skeptical with what they read, what they see, what they even want to do, and what they see in front of their eyes. So it's, I think, the best career that a person can have on planet Earth, being a scientist. It's really wonderful, and the most noble enterprise that Homo sapiens has ever launched. It's difficult, and it has lots of disappointments probably, and lots of negative results, not lots of positive results that get refuted. But one should just accept it as part of the game and even enjoy it.
Great. Well, thank you very much.
Thank you.